Hello, everybody. Welcome to another episode of Occupational Therapy for Life. Disclaimer I'm not your therapist, I'm not your provider. If you have any medical emergencies, you should always consult your primary care provider. Always keep them in the mix because they would know about your history, medical history, and what's the best course of action to take. All right. Oh, don't forget to like and subscribe. So today we're talking about hand clinic. So that's one of the settings that I didn't have a chance to talk about when I was covering the settings that occupational therapists work in, and it's a big major one. So hand clinic, as in the name, the therapists are working on a person's hands. So in order to become a hand clinic therapist, not only do you have to become an occupational therapist, but in addition to that, you have to do advanced training to become a certified hand therapist. And a hand therapist is not only occupational therapist, it could be also a physical therapist as well. So both of them have to get their regular training to become a therapist, in addition to become a hand therapist. So usually there's a process where you need to work in a hand therapy clinic, almost like you need experience. You need 3 years of experience, and then you need 4,000 hours of hand therapy and upper extremity therapy practice. So a lot of time that discourages therapists who might want to go into the field because of the requirements. So like I said, not only do you need to be a regular therapist, but on top of that, you need another 3 years of experience and 4,000 hours of practice, because the hand is a very delicate part of your body. With your hands, you can do so much. You control tools, you can manipulate the environment. It helps you to do all things. Without your hands, your life would be very difficult and challenging. So our hands are a very useful, dynamic tool, if you will. Even though you might take it for granted but not notice it, but see how you interact with the world. You usually require your hands to do a lot of things. So once you pass the certification, then you can use the designation CHT, Certified Hand Therapist. And once you do that, of course, you can go work for a hand clinic and just work with people that need that service. So usually the conditions or disease you might come across are hand trauma. Like this is somebody, I don't know, hit your hand with a hammer, or you slam your hand in a door or something and your bones got fractured, ligaments, and you sustain an injury. So a hand clinic or a therapist in a hand clinic can help you with that. Disease, congenital deformities, those are things that you are born with. Some people are born with certain deformities, and that they need a hand therapist to help them throughout the development process, to help their hands be more functional, stronger, and as useful as possible. You also work with doctors. Sometimes, people who get hand surgeries and things like that, they would need a hand therapist to help them rehabilitate their hands and the strength, the in-hand dexterity, manipulation of tools, and just overall to improve the function of the hands. People with fibromyalgia, frozen shoulder, osteoporosis, carpal tunnel syndrome, which is a very popular one. Most people have heard of carpal tunnel syndrome, and arthritis. And so I personally am not a hand therapist myself, but because I am an occupational therapist, if I wanted to be one, I can go through the process of getting the training done to have a CHT and a back of, in addition to my title. I worked with a hand therapist before, and a lot of his clients came from the community, and they did exercises, and he also applied splinting. So we're gonna talk about splint later on, but basically splinting it's a device. I'll call it a device for lack of a better word, and it helps position your hands and some of them it's in a fixed position, and some of them there's a progression of movement that takes place to help you strengthen or improve your range of motion in the hand if needs be. So there's all type of splinting, and the splinting material matters, how long you wear it for, and so forth. Now the salaries of a hand therapist from the website hand therapist certified.org, you can log on, and there's a section where you could check to see what the salaries are. Typically the salaries range from $75,000, the highest I've seen, to $115,000. Now those vary within your experiences and the state that you work at, and usually on average therapists are making around $90,000. So that's pretty much it, everybody. If you want to become a hand therapist, become a therapist, a physical therapist or occupational therapist. Then you need that 3 years of experience in addition to 4,000 hours of practice. All right, so signing off for today. Don't forget to like and subscribe. And until next time, have a good day.